Although irritable bowel syndrome, IBS, is the most common disease diagnosed by gastroenterologists, it's also one of the most misunderstood. That's why updated guidelines addressing the management of the condition are being released by the American College of Gastroenterology.
Irritable bowel syndrome is a very common GI condition affecting somewhere between 10 and 20% of the U.S. population. The last time the American College of Gastroenterology put out or published guidelines for the management of IBS was in 2002. There's been a remarkable explosion in knowledge that's become available that's helped us to understand the cause of IBS and also the management of IBS. So with that in mind, the college actually commissioned an update of the IBS guideline. There will now be a firm recommendation to screen for celiac disease in individuals with IBS symptoms that have diarrhea or a mixture of diarrhea and constipation. In addition, we also recommend that for individuals with diarrhea-related symptoms in the setting of IBS, if they undergo colonoscopy, the endoscopist should obtain biopsies from the colon to exclude a relatively unusual condition called microscopic colitis, which is a condition that leads to inflammation in the lining of the colon and subsequently the development of significant diarrhea. There's a comprehensive set of guidelines that addresses the various forms of therapy that have been critically evaluated in clinical trials in patients with IBS. So some of the other changes from the previous guideline are that now we feel that there's reasonably good evidence to support the use of antidepressants, tricyclic agents, and selective serotonin reuptake inhibitors for selected patients with IBS. Antidepressant therapy at low doses offers benefits for GI symptoms even in individuals that don't have comorbid anxiety or depression. There really are things to do for these patients. It's not a hopeless situation. In fact, most patients will benefit from a structured, focused diagnostic evaluation, and we can make most patients better by using a wide array of different therapies now.